My name is Anastasia. I'm a nursing student, and today I'm going to perform a skill called eye irrigation. Eye irrigation is usually performed to remove any foreign body from the eyes, such as sand or dust, or to wash off the chemicals that got exposed to the eye, such as alkali solutions, gasoline, or alcohol. For this procedure, today we're going to be using a normal saline solution, syringe, gauze, towel, something to wash our hands with, a little bowl, and if we have a chemical exposure, we might use any tubing that could be connected to the normal saline bag, pH strips to check the pH of our eye, as well as any anesthetic solution such as eye drops to decrease the pain in the eye. There are complications that could be done during the procedure, and it's usually cornea damage, and when that happens we will automatically contact the ophthalmologist. And there are some things that we can do wrong during this procedure, such as putting too much pressure on the eyelid, or maybe touching the surface of the eye with the irrigator, or using a gauze and touching the surface of the eye with a gauze. Today we're going to have a patient who came to the ED, and the patient complained that something got into the eye. So it's a 5-year-old female. Her name is Kashtanka, and we're going to help her to remove a little particle of the sand from her eye. So let's begin. So this is our Kashtanka. She complains that something got into her eye and it hurts. So before we start any procedure, we're going to introduce ourselves. Kashtanka, my name is Anastasia. I will be a nursing student today, and I will perform an eye irrigation. I'm going to verify her name and the procedure, make sure we're doing the right thing. I will explain her what I'm going to be doing and how long it takes. To remove the foreign body usually will take about 1 to 2 minutes, and if it's a chemical that got into the eye, it will take about up to 2 hours, depends on what chemical is in. Today it's a little bit simple. So Kashtanka, I'm going to be using a syringe that I will put some normal saline, and I would wash your eye with this solution. It's not going to hurt. And I'm going to use a gauze, I'm going to use a towel and a bowl. But before I start, I'm going to wash my hands. Okay? And we can ask our patient to be either in sitting or lying position. Depends what's more comfortable. Because Kashtanka is smaller size, I would ask her to lay down. Lay down. Very good. I would put a little towel underneath, so we don't gonna make her clothes wet. Okay. We're gonna tilt her head a little bit in the back. So we're gonna clean the eye that is on the lower side. Okay. I'm gonna keep the bowl when I'm gonna clean the eye. So it's okay, Kashtanka. You don't have to worry. It's alright. So I'm gonna get the normal saline solution. And I would be using a sterile syringe because I don't want any infection for her eye. Okay, get my gauze. Alright, Kashtanka, can you please lay your head? Yeah, it's alright. Lay your head. Very good. So I would get a syringe, and we will open the eye, okay, with your fingers, or you can use a retractor. Just make sure you be very gentle. And we're going to open the eye with our lids, and we will use the motion from the inner side to the outside, on top of the lower lid and underneath the upper lid. And we will keep syringe no more than 5 centimeters away from the eye. We're going to apply slow pressure to the syringe so we don't hurt the eye with the motion. And before we start, we can ask our patient to focus to fix their vision ahead. And while we're irrigating, we can ask to move the eye in different direction to make sure we clear every surface. And when we're done, we're gonna slowly and gently pat the eye, okay? And we're gonna look, make sure there's nothing left. Ask our patient how it feels after we're doing irrigation, and patient says it feels good. So after this irrigation of the skills, we will perform a visual exam to make sure that our patient feels good. And if it was a chemical exposure, we will be checking the pH of the eye between the irrigations. And after, we will also perform the visual exam. And with the chemical exposure, because the irrigation took longer time, we will recommend our patient to see an ophthalmologist 24 hours after the irrigation was completed. So for eye irrigation that's removing the foreign object, we can also instruct the family members that if that happened, we can perform that at home. And if you don't have a normal saline, we can advise to use clean warm water. And but if there was a chemical in the eye, it's very important to come to the healthcare professionals because it's considered an emergency. And if it's not taken care of right away, a patient could end up blind. I finished my skill, so thank you so much for watching. I hope it was helpful. Goodbye.